Good morning from California. My name is Guiyun from the University of California at Irvine. I'm the program director of the ICEMR in Kenya and Ethiopia. So I want to thank the organizer for providing us the opportunity to present our ICEMR. The central theme of our ICEMR is to examine the impact of environmental modifications from water resource development projects on malaria in Sub-Saharan Africa. In the past decades, Africa is experiencing rapid population increase. Food security becomes a major challenge. Currently, irrigation covers only 7% of the total cultivated area of Africa, the lowest in the world. Construction of dams and the irrigation schemes promotes economic growth, ensure food security, and alleviates poverty. Over 2,000 large dams have been constructed with more than 200 under construction or planning. Water resource development projects may affect vector ecology, such as creating more suitable breeding sites, modify vector population dynamics and the community structure. They may affect human settlement and the migration patterns, and promotes social economic development. So these factors act together and can modify transmission dynamics. So our ICEMR aims to address complex interplay between environmental, socio-economical, and the biological factors in malaria. So the program addresses important questions such as what is the impact on malaria burden? What are the underlying mechanisms for altitude malaria burden? And how to effectively control malaria in settings with extensive environmental modifications. We select Kenya and Ethiopia as the focal study countries. National malaria strategy of Kenya aims to reduce malaria incidence in the death by 75% by 2023 from the 2016 baseline, and establish systems for malaria elimination in select low transmission countries. Ethiopia aims to reduce malaria incidence in the death by 75% by 2025 from the 2015 baseline, and achieve nationwide malaria elimination by 2030. Due to COVID pandemic, funding for malaria control in these two countries have been substantially reduced to only $1.20 per person at risk per year in 2020, the lowest among the sub-Saharan African countries reported in the World Malaria Report. Access to LIN for both countries was below 40%, and the population at the risk protected by us below 10%. In addition to funding challenges, there are a number of challenges that limit the effectiveness of malaria control and the elimination programs. These challenges include insect resistance, vector biting and the resting behavior change, outdoor transmission, lack of optimal vector control methods and the strategies. Ethiopia accounts for about 12% of the global cases and the death due to virus malaria. Key virus relapse represents a major challenge to malaria elimination in Ethiopia. Additionally, as explained by Rick, environmental changes and the climate changes further modify malaria transmission dynamics and pose additional challenges to malaria control and elimination. Because our ICEMR addresses cross-disciplinary issues on agriculture, water management, human health, so we have built a strong partnership with various government agencies and academic institutions in Kenya and Ethiopia, including Ministry of Health, Agriculture, Water and Irrigation, and Education. We partner with PMI, the group funds, National Irrigation Authority, local health facility staff, community health workers, and local communities. The program involves a good number of private institutes from the US, Kenya, Ethiopia, and Australia. The key participating institutes include UC Irvine, Case Western Reserve University, Ministry of Health of Ethiopia, Jimma University, Addis Ababa University, Ministry of Health of Kenya, Maseno University, Tamboya University, Kenya Medical Research Institute, and the Benin Institute. Our ICEMR is expanding collaborations as the project progresses. So the list is growing. Here shows our ICEMR team members. With this brief introduction, we like to feature 4 short presentations. With me represent the US speaker, 3 other speakers from Kenya and Ethiopia. First, I'd like to discuss our findings on the impact of environmental modifications on malaria epidemiology. Due to time constraint, I will focus my talk on one question. What is the impact of dams and irrigation on malaria burden? I will present our findings from empirical field studies and modern studies. We designed 4 study sites, 2 in Ethiopia and 2 in Kenya. These sites vary in transmission intensity and the cropping practice. In Ajo, Ethiopia, this is a sugarcane plantation site with low transmission intensity, and the PYX being the predominant species. The Gambela site is a commercial rice plantation site, high transmission, and the Falciparum, the predominant species. In Kenya, the Homa site is a mixed crop, site, and whereas Kisumu site has no irrigation. We used multiple eco-epidemiological settings to test the generalizability of the study findings, and also to address challenges unique to each study country. In each site, we used multiple villages or clusters. Each cluster has about 150 to 300 residents. This cluster will distribute within or outside the irrigation area, forming a switch pattern. They vary in exposure risk based on their distance to irrigation, elevation, and other factors. By measuring malaria incidence in each cluster and the confounding factors, we can statistically factor out the impact of irrigation on malaria burden. We conducted passive case surveillance from health facilities, active case surveillance from community cohorts, and age-stratified cohorts in school children to examine both clinical malaria and asymptomatic infections. This design is to comprehensively assess the impact of irrigation on malaria. This shows ICEMR researchers working with staff in local health facilities, and ICEMR researchers conduct active case surveillance in local communities and the schools. All right, here's the result. Cross-sectional survey found that malaria infection prevalence was significantly higher in irrigated clusters than non-irrigated clusters. And this pattern was consistent across dry and the rainy season for the 4 years study period from 2018 to 2021. PCR found 2 to 3-fold higher prevalence than microscopy and confirmed higher infection prevalence in irrigated area. We observed gradual reduction in malaria prevalence over the 4-year study period. This gradual reduction resulted from the indoor residual spray program introduced in 2018. Similar results was found in an independent school children cohort that generally have the highest infection risk. Again, we observed gradual and remarkable reduction in malaria prevalence among school children from 2018 to 2021. We found clinical malaria incidence rates in irrigated area was significantly higher than non-irrigated area, with an incidence rate ratio of 2.9. We measured the molecular force of infection, which is defined as the number of new falciparum clones acquired over time, and which is more sensitive to changes in transmission due to irrigation. We found that molecular force infection among residents in irrigated area was 5.3-fold higher than those in non-irrigated area. So these results demonstrate irrigation was associated with higher malaria burden. higher malaria burden in irrigated classes can be visualized from the distribution map of clinical malaria incidence rates. High incidence rates was observed in villages within or near the irrigation site. To better predict the impact of irrigation on malaria larval ecology in the malaria risk, we integrate physically based hydrological modeling with remote sensing and entomology to emote malaria model. In this process, we used multi-layer environmental data, including meteorological, topographic, land cover, soil, geographic data, and others obtained from remote sensing, and the model calibrate using field entomology data. So the goal is to help design optimal water management strategies. Here shows the baseline result, natural rainfall fluctuation without irrigation. So during the 10-day period model, there was a rainfall event in the middle of the week with the peak daily rainfall of 40 to 70 millimeter water. Soil saturation index was low before the rainfall events and increased with the rain in the middle of the week. For the corresponding wetness index, which measures the likelihood of larval habitat formation, is increased from an initial value of zeros, which is represented in gray, and spread out in areas as rainfall build up. As the rainfall decreases, the wetness index continued to increase for the areas where the ponding still persists. On the other hand, the wetness index reset to zero for the remaining area, indicating that they had dried up. We then simulate the effect of irrigation on larval ecology. There are 4 sub-irrigation areas, each using spray irrigation, and the irrigation schedule rotated every 5 days. Here shows the effect of irrigation on soil saturation index. The simulation was for a period of 5 months, from January to May. There was one small rainfall event in February, early April, and a large rainfall event in May, as shown in the left figure. The right figure shows the soil saturation index. So in January and early February, the area was dry, low saturation index, except irrigation area. The rainfall event in February, April, and May increased the saturation index for the whole area. The impact of irrigation can be seen from the rotational fluctuation in these 4 sub-irrigation areas. So overall, irrigation increased larval abundance, larval habitat abundance, prolonged habitat stability. Importantly, irrigation modifies human mosquito contact risk. In this simulation, we consider human distribution, human movement, mosquito dispersal in the study area. Without irrigation, high-risk area for human mosquito contact during the dry season was concentrated to several small areas where there were some permeable sites. During the rainy season, the high-risk area was expanded as larval habitats become widespread. In the irrigation situation, high-risk area in the dry season was much larger in comparison to the non-irrigation area, non-irrigation situation, because irrigation created abundant mosquito sites. On the other hand, the difference between the dry and the rainy season was small because irrigation increased larval habitat stability. So in this presentation, I showed you increased malaria burden associated with water resource development in Kenya and Ethiopia. Water resource development project is very important to the economic development and food security. So the implication of our study reaffirms the need to conduct comprehensive impact assessment on malaria and other infectious diseases prior to construction. Modern work can help with risk assessment and with developing rational water management strategies to improve food security while control malaria and reduce health burden in the local communities. In this regard, inter-sectoral collaboration and the community engagement are crucial.